Hey everyone, welcome to Therapy Cove. My name is Amrita Sandhu, and this is a safe space of healing, self discovery, and rewarding change. Today, I want to talk about something that does not get talked about enough. I want to talk about something that was personally a game changer for me and something that I see the benefit of every single day. What I'm talking about here is the mind and body connection, the way that what we go through emotionally can and often does show up in a subsequent way in the body. Now, how many times have you felt anxious and it messes with your gut? You got to go to the bathroom a ton, or maybe you get nauseous and you're gagging. Or how many times have you been stressed out and you develop a tension headache? Now, these are some of the more prevalent and obvious ways that trauma or stress or negative emotions can show up in the body. But often there's a lot of subtle telltale signs that what you've gone through, maybe even in your childhood, might be showing up in adulthood and impacting your physical health. So let's talk about the top three ways it shows up in your body and impacts how your body's functioning. The very top, most prevalent way is with joint pain or inflammation in the body. So let's do a little thought experiment here, or maybe you yourself can relate to this. Imagine there's someone that has a desk office job, and day in and day out, they're stressed out about deadlines and work and all these meetings. And what do? They hunch up their shoulders, they hold tension in their upper body, in their neck and in their shoulders. Prolonged hunching and building tension leads to inflammation. Here's the mind body correlation. What does inflammation lead to? Disease. So, oftentimes and traditionally, we have thought as mental health as existing over here and physical health as being its own thing way over there. And how much do we see this in so many cultural groups that the dialogue around physical health is normalized and commonplace? We'll chat about it at dinner parties, we'll talk about it at work. We will very easily, perhaps not so much for males who tend to be avoidant with doctor's appointments, but it's a lot more acceptable and normalized to go chat about blood pressure, cholesterol, and get blood work done when we have a physical complaint. But seldom do we ever try to correlate that or trace that back to some sort of emotional distress, insecurity, or unmet need. And this is where somatic therapy can really come in handy, because now we're doing something called bottom up processing. We're dropping down into the body and saying, hey, what's the story that my body's been trying to tell me all along? The thing that's really tricky is that we are programmed to think that we can think away our distress. Even traditional psychological interventions or modalities for therapy have been heavily reliant on the cognitive. Think about if you've ever been to therapy. What did the dialogue usually look like? Maybe you talked about reframing thoughts. Maybe you talked about habit building, how to change your behavior in order to have a more pleasant emotion or a more pleasant thought. But that's only half of the story. Often the other half of the story gets deeply neglected. Other ways that trauma and mental distress can show up in the body is by stealing your sleep. Very often, I hear my clients complain of insomnia or perhaps even oversleeping as a coping strategy. Now, this is not a choice. This is your trauma trying to tell you that something's wrong. Because life is so busy and because most of us are in the rat race and everything's consumerism driven, we don't have a lot of opportunity to check in with what's going on during our daily life. So when our head hits the pillow, that's when all the stuff we've been tucking down nice, neat, and pretty into a corner decides to come up and say hello. Because that's when things are quiet and it has the room and space to come and say hello. So, very often we'll see sleep disturbances, we'll see impacts to appetite, either overeating or appetite suppression. Another way that it can show up is with fatigue and exhaustion. Have you ever had something you're stressed out about and you're ruminating about it over and over, that even if you haven't moved your body physically, you're exhausted, you're emotionally exhausted because your brain is taking up all the energy from your body and putting your nervous system into overdrive? And that too has a very real physical impact on yourself. So, all this stuff is the side of the story that's often neglected, often unaddressed, and absolutely worthwhile to start paying attention to. Attunement to what our body's trying to tell us is such a revolutionary thing when it comes to healing, wellness, and self discovery. Now, as you may have experienced, anxiety is a really real physical experience. It can increase our heart rate. Perhaps sometimes you've even heard of you, or you yourself had landed in the emergency room because of an anxiety or panic attack, because it does feel like something is very, very wrong and our life is in danger or under threat. And this is exactly what unresolved or unhealed trauma does to us, is it puts a lot of duress on our nervous system so that our heart rate is increased, our breathing is increased, our blood flow is away from our brain and more in our extremities, and it kicks us into that primitive survival mode of fight, flight, freeze. Prolonged, extended periods of time of being in that primitive survival zone is not good for the other systems in your body. And this is why it's so important to take your mental health seriously and realize that it is a big part of your physical health. These types of things that are being repressed, often your body will express it to you. And how will it express it to you? With panic attacks, with anxiety attacks, with that chronic fatigue, with the headaches. And sometimes, and a lot of research shows, there is a correlation between autoimmune disorders and previous trauma, as well as hormonal imbalances. So, how much do we see PCOS or fertility issues in the culture, in the diaspora amongst females? And females do tend to repress emotions very well and mask, because they tend to be very hyper vigilant to their role in their families, in caretaking, in showing up in their best possible self. But often that leads to a lot of self abandonment. And of course, if we're self abandoning, then our body's going to start yelling at us. It's going, hey, you're not listening to the whispers, so let me yell. This can also show up with really severe gastrointestinal issues. How much have we maybe heard about or experienced ourselves IBS or acid reflux? So, when there's duress on one system in our body, like our nervous system, because of the things we've gone through, it causes us to tense. It causes us to have these unpleasant responses and go into fight, flight, freeze and be in overdrive, takes up a lot of our body's energy and bandwidth. Well, there's going to be some sort of consequence to that. And often that is presented in our digestive system and our endocrine system. And all these things play a role in how we function on our day to day. So if you are feeling overly tired, if you are having headaches, if you are making trips to the doctor's office and they can't give you any answers, or you're not seeing any success with what you've been trying to do thus far, that is a medicinal route, which is important. It has its place. We're not negating the importance of physicians and biological approaches, but we cannot neglect to address the fact that sometimes we got to look at the other side of the story, which is psychological. It's so key and important to have that dialogue be normalized and a part of the equation. Otherwise, there might be things in the peripheral that are blind spots and just subtly accumulating until then it comes right in front of our face and we can't ignore it anymore. And what we have at that point is what is called a psychosomatic symptom. And sometimes trauma can present in such a significant way that when doctors don't have answers, then they say, okay, it's stress induced. And this is where we can see severe psychosomatic symptoms such as losing muscle functionality in our face or our eyelids, or sometimes we can have these extreme bouts of becoming suddenly very ill. I'll share a little personal anecdotal information. How did I end up becoming a healer? How did I land in this space? It was because at one point, many years ago, just shy of a decade, I ended up having a psychosomatic episode of temporary vision impairment. I had seen something very traumatizing and distressing that put my whole life onto its axis. It just completely was a life quake. And this ended up presenting as very momentary, brief spurts of temporary blindness. Now, this will scare anyone straight, but it especially was very jarring and personally impactful to me. And that is how I learned about somatic therapy. And I realized that the mind body connection is such a key important aspect to life and functioning and wellness. And I really hope that this did not come across in a fear inducing manner. I'm passionate about this because, like I just mentioned, it's It's personally relevant to me, and that is why I speak with such vigor and candor and passion. Because if there's even one person that listens to this or watches this and decides to delve into the world of somatic therapy, I promise you, you will only benefit from whatever experience you have. I really, really appreciate you taking the time to listen to what I had to say about this topic. As usual, thank you for listening. See you next time.